Welcome. Today we're going over something so important. It's what plagues most of society, lower back tightness, especially in the sense of flexion and extension. We usually sit in these rounded kyphotic positions for a long amount of time. So today we're going to do a couple of things to try to loosen up some of the tissue of your lower back, get you moving and feeling better so then you can get back into fitness, working out, and doing some things that maybe you're hindered by because you're tight right now. What we're going to need today is a lacrosse ball as well as a TheraBand, and we're going to get started. So once we have our lacrosse ball, we're going to lay down on the ground face up, and we're going to take the lacrosse ball and we're going to put it on our erector, so next to our spine, right? So if my spine is here, I want it right to the side of it on either side. We're going to go ahead and lay back, placing the lacrosse ball in that area. From here, once I find a spot that's tender, it's going to be pretty obvious right away, okay? You can lock the opposite leg out. The leg that the ball is on that side, I'm going to grab with my hands and I'm going to pull that knee into my chest. Now what I'm doing is I'm going into a posterior tilt and I'm pushing the ball into the tissue more so, okay? So this makes it more intense. If this is too much for you, you can just have your leg wherever it is, take deep breaths. You can push your belly down by tilting your pelvis. Anyway, we're going to do 30 seconds per side here, okay? So I'm setting a timer, 30 seconds per side. I want you to explore around and try to find tissue that's tender. Again, if this is too much, we need to get a lacrosse ball, a tennis ball, invest in something softer that you can use back here. Maybe you rock left to right a little bit and you get it to go more toward your QL, the side of your lower back. Again, we are just trying to promote some blood flow and increase fluid dynamics so we can be more effective when we try to stretch and then work out some of our core. Most of the reason our lower backs get tight is our core is not doing its job, right? Good, we're going to switch sides. It's not doing its job and our lower back is overworking in a lot of positions that we put ourselves in. Could also be related, excuse me, to faulty movement mechanics as well. Maybe we're not moving how we should in the sense of maintaining a neutral spine, rotating from our upper back, not our lower back when we're going to move and turn around. Not engaging our core properly. So it could be a factor of things, but the moral of the story is our lower back is overworking and our core is underworking. And today we're going to loosen up the tight tissue and try to strengthen the weak tissue and get you feeling a little better for the rest of the day. Okay, good there. Next, we want to start by getting slight movement into our spine, okay? So we're going to start really slow here. So next, I want us to work on cat-cows. So from a tabletop position, we're going to do 10 repetitions of going into an anterior pelvic tilt. I look all the way up, I arch my lower back. Deep breath in, I round, deep breath out, I look down to the ground, posterior tilt. Deep breath in. Deep breaths here. Super important as you go through this process. Again, we sit in positions most of the day at work, then we sit in our car or commute home, then we get home, and then you know what we do? We sit and we watch TV, or we do more work. And we just need to do more things standing, using all the musculature of our hip and our core. Almost there. Okay, beautiful. Next, we're going to do a hamstring stretch. So we're going to use our TheraBand. We're going to lay all the way back. I'm going to set another timer for 30 seconds. I loop the TheraBand around my foot. I have my leg locked out. I'm going to set a timer for 30 seconds. Now from here, I'm just trying to get my leg back as far as I can with my leg relaxed but straight. And then I just take deep breaths here. If I put it more toward my calf and I flex my ankle down, I can get a little bit more of a calf stretch as well. If you're someone who's a runner or a biker, might be extremely beneficial. This tissue might be extremely tight. And that's going to affect your ankle mobility, again, which will affect up the kinetic chain of events happening. Deep breaths here. One thing about our hamstrings is when we have very tight hamstrings, switch sides, when we have extremely tight hamstrings, we end up not being able to articulate and tilt our pelvis how we should when we go to pick things up, because that tissue is too tight, and again, it's part of the chain of commands in us being able to tilt our pelvis. It needs to lengthen out for us to keep a neutral spine when we go to bend and pick something up. So us sitting on our butt all day, again, mashing our hamstrings down into the chairs we sit in, not helping us So again, providing some blood flow here. I'm trying to really work on pulling this leg back. My other leg flat to the ground, toe to the ceiling. I'm not letting my hip rotate out. And beautiful. Good there. Okay, next up, I want us to do a little bit of articulation with our spine. We're going to do this from a seated position. So if your hamstrings are really tight, sitting in an L-sit for you, this is an L-sit, is going to be extremely challenging. So what we're going to do is we're going to take our TheraBand, and we're going to work on that cat-cow concept. We're going to do almost like a Jefferson curl, but seated from the ground. So we're going to do 5 repetitions of this, nice and slow. So I'm going to walk my hands forward, go into flexion. I'm going to allow my lower back to round. And then what I'm going to do is when I get a big stretch, I'm going to slowly think about straightening every vertebrae that I can, one at a time. As I sit back, the band is fighting me. And then I take a deep breath out. And then I slowly round every vertebrae forward again. I get to my end range, just take a deep breath in. I think of straightening every vertebrae as I sit back. Deep breath out now for that I took in before. And I round forward as much as I can. Maybe you get to your toes. Deep breath in, hold it, straighten. And deep breath out. And again, every time I breathe out, I went a little further. Last one. Okay, last but not least, now we're going to do a little bit of core activation. We did a lot of stretching of tissue that's probably tight, making us feel, tension in our lower back. Now let's activate our core, promote more blood flow. Last thing for the day, we're going to lay down on the ground face up. I'm going to set a timer for 45 seconds here. Okay, we're going to do a McGill sit-up. Stuart McGill is a world-renowned physical therapist. He is known for rehabbing athletes from catastrophic back injuries to then being able to go back into their sport, powerlifting. And he has a protocol, it's called the McGill Big 3. This is his variation of it's called a McGill sit-up. It's like a hollow hold. What we're going to do is we're going to focus on, from a kneeling position or from our feet flat on the floor, laying face up, we're going to focus on a posterior tilt, pushing our lower back against the ground. Once we're here, I can't fit my hand under my back anymore. I put my hands behind my head, and I lift my torso up off the ground like a crunch. But I'm maintaining this posterior tilt. I have a neutral neck. I'm not rounding and arching and having bad upper back posture. I push my head into my hands down so I can almost work my neck at the same time. And I hold this position for 45 seconds. Now again, my upper back is pulled up off the ground. My core is really having to work to hold this position. Lower back down, feet flat on the floor. 45 seconds. Deep breaths, nose breathing as much as you can. Because you're maintaining this posterior tilt, only your core can work here. If you arched your back, now your lower back can work, but you're not. You're keeping that posterior tilt. 5 more seconds. In 3, 2, 1. Oof! If you got extra time and you want to do a few more rounds of that, please be my guest. But that finishes it up for today, guys. We just worked on providing blood flow, stretching out tight tissue for our lower back. It's so important that we move well without pain, because if we're settling and we have back pain daily and we're not trying to make it better, it's going to get worse and worse. It's going to affect other movement patterns that we try to do, because now we're subconsciously changing how we move, and it's just going to cause more wear and tear. So please take care of yourself. Reach out if I can help in any way, provide you more information on how to relieve these things, or if I can send you to a great physical therapist or a massage therapist, acupuncturist. Please reach out to me. I will help you find the person closest to you that can do you wonders. I want you to feel better. Thank you for being here today. I appreciate you. I look forward to seeing you at the next one of these. Have a great day.